Thank you very much, and good afternoon to everybody. I'm going to be talking about impact evaluation within the CGIAR as relates to the theme of this conference. In one sense, the CGIAR has a pretty good record of impact evaluation. We have literally dozens of studies that support the fact that investment in the CGIAR has been a very good investment. It's paid off very handsomely. We have one meta-study a few years ago putting all this together, showing that perhaps every dollar invested in the CGIAR gives you about $10 in return. Now, that's the good news. The not-so-good news is that when we come to the theme of this conference on the impact of investment in the CGIAR on health and nutrition, or vice versa, we don't have as much to show. And there are a number of reasons for that. One, of course, it's much more complex to look at these types of impacts than it is to look at economic returns. We're looking at effects that in many cases are very long-term, particularly in terms of child nutrition. You almost need a life cycle of data. You're looking at effects both ways, complex interactions between health, nutrition, and agriculture. Many of them are indirect effects, and sometimes are unintended effects. And it's not very often we do impact evaluation looking at unintended effects. And many of them are quite hard to measure, particularly when we get into nutrition or pesticide poisoning. Nonetheless, I think we have some good examples out there that we can build upon. And let me just talk about two of the areas. One is on nutrition. And we just heard an excellent example from Harvest Plus on evaluating the impact of orange flesh sweet potato. I think that's really a good example of what we need to do more of in terms of the relationship between agriculture and nutrition. We have some other related work in the CGIAR also using randomized control techniques on quality protein maize. But even that example is at a fairly local level. It's a direct effect. And as we scale up, we need to think about much beyond the direct effects and some of the indirect effects through markets, and particularly market prices. We have some examples of that type of impact evaluation in the CGIAR, and I go back to a study, it's actually almost 10 years ago, looking at the impact of investment in crop genetic improvement, crop varietal improvement, in the CGIAR almost since its inception. Work done by IFPRI, Bob Evanson and Mark Rosegran, looking at both the direct effects through incomes and indirect effects through employment, and particularly through food prices. And they estimated, and they had a model to be able to look at the impacts on child malnutrition. And their estimate at that time was that without the CGIAR, we would have 15 million more malnourished children. Again, it's modeling work. Models have always got assumptions, and we can certainly do a lot more to improve upon that work today. The second area where the CGIAR has done quite a bit of work related to the theme of the conference is on pesticides, integrated pest management. And I think there's a very nice study, just picking out one of those from Erie. There's actually pioneering work done almost two decades ago by Prabhu Pingali, agricultural economist who may be here somewhere, and the Agnes Rolla, a medical doctor. So 2 decades ago, we had examples of economists, evaluation economists, working with medical practitioners to look at the impacts of pesticide use on rice, on health. And they went and did very detailed data collection on medical costs due to pesticide use and pesticide poisoning, as well as days lost from work. As I say, a very comprehensive analysis of that. And the nice thing is that was done 2 decades, or early 1990s. Nice thing is we've just published a study just last month looking at the impact of that work on pesticide policies and regulations in the Philippines. And there's a good ending to the story, because I think it did have, and we were able to fairly convincingly show that the evidence, the hard evidence from this work, led to changes in pesticide policies in the Philippines, which essentially eliminated the most toxic pesticides, and actually also through changes in pesticide recommendations, a reduction in pesticide use by about 80%. So I think that's a really nice example of how getting the hard evidence can lead to changes and improved health outcomes. SIP, the International Potato Institute, has also done related work, and I think very good work, looking at the impact of pesticides and IPM on health impacts. So that's another area I think we can point to some success. But there's not much, and what we really need to do is do more work in this area. It's something that we're now, as the Standing Panel on Impact Assessment, very actively exploring, and we just put out a call for proposals 2 weeks ago, asking for proposals to look at impacts of agriculture on undernutrition. So let me finish up with where I see we need to go in this area, because we're clearly not only underinvesting in evaluation, but underinvesting in evaluation related to health and nutrition impacts. Clearly we need to, I think there's 4 areas that we need to improve upon. One is understanding, and that's the research to be able to understand the pathways and the links between agriculture and health and nutrition. That's really essential if we're going to do better evaluation. Second area is on data systems. We're doing a much better job now with household panel data sets on incomes and expenditures. Somehow we need to link in variables related to health and nutrition into those sorts of data sets so that we can really look at them in an integrated manner. Similarly, on the modeling side, on the macro side, the data on country level indicators of undernutrition, I think, is an area that we could greatly improve if we're going to track our impacts in this area. The third area to invest is in methods. I think we've got certainly got to move towards much more rigorous methods in this area. Use of randomized control trials, but they have also their own limits, and they can only be used in, I think they're particularly useful in the early stages of evaluation, much less useful in the later stages, but I think we're making good progress in a number of other statistical techniques that we can use in methods. But certainly a lot of work to be done on this. And then on modeling. As we start thinking about evaluation at scale, you're really forced into looking at models and using models and then integrating health and nutrition variables into modeling work, I think is an area where we need to advance. And finally, capacity for evaluation. I think this is a CGIAR, despite my earlier comments that we have a good track record. I think we're underinvesting in the whole area of evaluation. We need dedicated people for this work. They have to have particular skills. This is not something that you learn overnight. It's becoming a highly specialized area. And we need the resources to get the job done. I don't think Dan talked about the resources that underwrite that work, but I know it's an expensive exercise. So, but I think this is an area where we need to put more attention. And finally, just to bring us down to earth, I think we need to define reasonable expectations in this area. It is going to take us some time to build up the data and methods and so on, so we can really start to the next time we have a conference like this, we can really put a lot more evidence on the table on what's been the impact of CGIAR research on health and nutrition and vice versa. I think we're making progress, but we have a lot to do. Thanks very much.